So in this section, we're going to talk about the benefits and safety around exercise. So some of the things that we know that are really beneficial side effects for exercising are that exercise will actually help to increase your HDL. So that's your good cholesterol in your system. Exercise is also being shown to decrease your blood pressure. So that's something that you'll see quite quickly after exercise. If you were to take your pressure before exercise and then wait a few minutes after exercise, it should be lower. We know that people that take diabetic medication generally can reduce some of that medication the more that they exercise. Exercise will also help to decrease your body weight or help you to maintain an ideal body weight. People that are trying to quit smoking have a better chance or have more success if they add exercise to their daily routines as well. And we know that exercise is really beneficial for decreasing stress hormones and actually increasing endorphins in your system. So it can be quite effective for people that have mild to moderate depression. So from a physiological standpoint, some of the benefits that happen with exercise are that your body actually starts to create more capillaries to feed the muscle groups that are asking for oxygen. So what that does is that means that you can go longer and harder before you start feeling cramping or burning in your muscles, which is generally a symptom of not having enough oxygen. So what can happen as well is we call it increasing the ceiling. So the ceiling gets pushed up on feeling of cramping, which is a buildup of lactic acid in your system. And the other benefit is that if you're somebody who suffers from angina or chest pain, that ceiling is also increased. So generally you can start exercising longer and harder before you'd have to stop because of chest pain. So that kind of goes into our next topic, which is it safe for me to exercise yet? So most people that we see, that's the number one question that they have. And we know that exercise you're at highest risk of having a heart issue or a heart attack or any kind of cardiac risk if you're exercising at a really high level that you're not accustomed to yet. So I think of the example of somebody who's sedentary, who does no exercise, getting up to, say, chase a bus or to chase a child into a street. They're at higher risk than somebody who has a really good base of aerobic conditioning. If they were to do something at a higher intensity, they are at less risk of having a cardiac event.